Hello, this is Dr. David Green, CEO of the TEX-PAIN Network. Today's topic, what you need to know about whiplash. Whiplash involves a hyperextension and flexion injury to the neck when one's head suddenly moves backward and then forward due to a sudden shift in direction. These extreme motions push the neck muscles and the ligaments beyond the normal range of motion. So here you can see the normal position, and then significant flexion, and then big time extension. Most commonly, whiplash occurs from a rear-end automobile accident, far and away. Also, there's other different types of motor vehicle accidents, sports injuries, amusement park rides, incidentally, slips, trips, and various falls can cause whiplash, assaults. There's over 3 million cases per year. It occurs more often in women than men, which is thought to be due to the differences in anatomy between the sexes in the necks. Symptoms of whiplash are going to vary between patients, but often it's neck pain, neck stiffness and spasms, headaches and dizziness. There's a very high association between concussions and whiplash. Blurred vision, fatigue, memory problems, irritability, and then difficulty concentrating and sleeping. It's unclear why whiplash occurs. It appears there's ligament damage in both the front and the back of the spine. There also appears to be damage to the facet joints of the neck. This can lead to post-traumatic arthritis along with chronic neck pain. Treatment options for whiplash include medications such as anti-inflammatories, Tylenol, opiates, muscle relaxers. In addition, bracing, physical therapy, chiropractic treatment, acupuncture has actually shown exceptionally good results. Spinal decompression therapy involves computerized intermittent traction. That can have some great benefits. Interventional treatments may include facet blocks, trigger point injections, medial branch blocks, and then possibly a radiofrequency ablation. A facet joint injection involves placing steroid, here's the needle going into the facet joint itself. Okay, this steroid may stick around for weeks to months and provide exceptional pain relief. Trigger point injections are much more subcutaneous back here in the muscle, and they're very good for relieving spasms. Here you see a radiofrequency ablation. So this is actually in the lower back, so disregard that part, but the anatomy is very similar. So you have the facet joints on the left, the right, left, and the right. And these little nerve endings called the medial branches provide sensation to the joint. All right. So if a facet joint injection or an injection around this area called the medial branch block provides pain relief and then wears off, a person can go on to have a radiofrequency ablation, which involves placement of a catheter around the area with thermal energy going through it, which can deaden those nerve endings for anywhere from 6 months up to 24 months of pain relief. Typically, the prognosis is excellent for outcomes with whiplash. The head and neck pain typically resolves within 3 months, along with any of the concussion-type symptoms. 15% of those with neck pain from whiplash do end up with chronic pain. That number can be decreased with some or all of the treatments that have been mentioned here, fortunately. The top non-operative pain management in the Dallas-Fort Worth area is through the TEX-PAIN Network. There are several clinics accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Green with the TEX-PAIN Network. Your pain stops here.